I would say that the first signs were the common diagnosis, self-diagnosis of a smoker, that which we call the smoker's cough. So I was just attributing the coughing that I was having to, I think, yeah, I've been smoking for years already, so this is just part of it. And it wasn't really a bothersome cough at that, so I really didn't pay too much attention to it. I didn't know that it was already dangerous. Fear, of course, the first thing was fear. As a smoker, it was the one thing that you knew that there was that chance always, but you always were trying to talk and convince yourself that it's not going to happen to you. Had it been anything that had to do with my work, I could easily say, modesty aside, I know what I'm doing. But when it got to this disease, I had to really put my life in the hands of my doctor. We started with Dr. Romel Carino, my thoracic vascular doctor. The first action was to remove the lump on my lower right lung. He had to take away a third of my lung. About after a week, my oncologist saw me, and then he told me, I would rather that we do treatment for you. And I would say that I'm very blessed. The Lord blessed me because it was found early. But that, aside from that, the treatment went fine and well. I would dare say that I was very blessed that the Lord gave me a family. That He gave me a wife, He gave me 3 children who were very supportive and who really, they were really my source of strength and hope when I was going through this disease, through this trying time in our lives. A big part of the healing process is brought about by the caregivers who are around you or the people who will take care of you as you go through your journey of healing. It really is one step at a time when you think about it, because there's, first of all, it's the acceptance that you have this disease, and then it's the journey that you have to go through. Like, it's always there in your mind, every hour, on the hour, you're thinking about it. You're starting to worry that you might not get through this. The important thing is being honest to yourself and honest to your caregivers, especially if your caregivers are mostly your parents or your family, your wife, your children. Basically, the only advice I can give them is, for the caregivers, be strong for the people who are going through this sickness. Make them know that you'll be there for them and that you're not going to give up on them, no matter what happens. And for the guy or the girl who's going through it, like I said, you can depend on everything else, but the most important thing is depend on God. Call upon Him. Unfortunately, I lost my eldest son to this disease. And I wouldn't want to see more people being taken by this disease.
Malaya akong lumalaban sa sakit na nagpapahirap sa maraming Pilipino.
Nagpapahina sa kaibigan, kapamilya at kapuso.
Malaya akong lumalaban sa paniniwalang ang pagaling ay hindi lamang isang pangarap.
Dahil ang pag-asa ay para sa lahat, mayaman man o mahirap.
Malaya akong lumalaban sa pagwawalang bahala dahil sa isyong ito, buhay ang nakataya at kinabukasan ng pamilya.
Malaya akong lumalaban sa pagkakanya-kanya dahil mas malakas ang ating tinig kung tayo magkakaisa.
Malaya akong lumalaban sa cancer.
Kasama ng mga nagtagumpay laban sa sakit na ito.
Kaisa ng mga biktimang hindi sumusuko.
Malaya akong lumalaban sa cancer.
Kasama ng mga taong umaasa na sa malapit na hinaharap. May kalayaan na sa cancer para sa lahat.
Malaya akong lumalaban sa cancer.
Access to cancer treatment is important because it increases cancer survivorship and reduces the burden on families and cancer patients. I am Susan Africa Manican, the wife of the late great actor Spanky Manican. As caregiver, I held Spanky's hand throughout the physical, financial, and emotional challenges of the cancer patient journey. Being a cancer patient caregiver is very challenging, but believe me when I say, may pag-asa pa at may magagawa ka pa laban sa cancer. Hope from Within is an advocacy that promotes cancer awareness, better access to new treatment options, and hope for survival for all patients. The Philippine Society of Medical Oncology currently has ongoing efforts to push for better access to more responsive and affordable healthcare services for cancer. Join us in advocating for equitable, affordable, and timely cancer care services. You can sign the petition by visiting the link below. To know more about the advocacy and want to be part of a community that aims to renew hope and optimism for the thousands of cancer patients and survivors, follow Hope from Within's Facebook page at Hope from Within PH or visit hopefromwithin.org.
Hi, good afternoon, everyone. I am Dr. Meredith Garcia-Trinidad, a medical oncologist, and on behalf of the Philippine Society of Medical Oncology, Cancer Coalition PH, and Hope from Within Cancer Advocacy Campaign, I would like to welcome you all to our special webinar this afternoon entitled Cancer Care in the Time of COVID, Challenges and Collaboration to Create Patient-Centered Solutions. So we are all currently living under trying times. Ever since the World Health Organization declared COVID-19 to be a pandemic on March 11, 2020, we have all started experiencing many changes in the way we live our daily lives, including the way we work, the way we interact with others, and in just about every aspect of our life, and that includes health. So imagine how it is for our vulnerable patients, especially that of our cancer patients. We know that cancer is among the leading causes of death in the Philippines, even before the pandemic has struck our country. Now, during the pandemic, our cancer patients are faced with additional challenges because of the changes in the infrastructure in our country when the pandemic was declared. So now they have additional concerns about getting their treatment, about getting infected. So aside from the baseline anxiety that they already have, this is now coupled with additional fear from either getting the disease or from getting their treatments delayed. We know that a delay in receiving treatment for cancer can lead to a poorer prognosis. But at the same time, they are also scared to go to the hospital or to see their doctors because they are scared of getting the infection. According to studies, cancer patients are not exactly more vulnerable to developing COVID. However, they are more prone to developing complications and increased mortality when they acquire the COVID infection. So today, we will be discussing the challenges encountered by our patients and also proposing solutions, possible solutions to these problems that we will be talking about today. The objectives of our webinar today are the following. We want to highlight the importance of prioritizing the continuity of cancer care in the midst of the COVID-19, emphasizing that cancer patients are most vulnerable to severe complications due to the virus. We would also like to raise awareness on guidelines regarding cancer care services in order to provide both cancer patients and healthcare workers the safety and assurance. We also want to provide information that will help cancer patients and caregivers navigate the treatment journey together with physicians during the COVID-19 pandemic. We also want to communicate to the audience that cancer patients will be given the support that they need and deserve during these uncertain times. So, we want to send the message that cancer care does not stop during the pandemic. For the first part of our webinar, we will be talking about the status quo and responding to the challenges of cancer care during the COVID-19 pandemic. Our first speaker will be Dr. Buenaventura Ramos, or we fondly call him Dr. Bill. He is a fellow of the Philippine College of Physicians and the Philippine Society of Medical Oncology, and is the current chairman of the Department of Internal Medicine of Southwestern University School of Medicine and Medical Center. He is also the current president of the Philippine Society of Medical Oncology. Let us all welcome Dr. Bill Ramos.
Thanks, Dr. Meredith Garcia, and thank you to Hope From Within and Cancer Coalition for this opportunity to reach out to the public during these challenging times. My slide. Can you show my slides? Okay, next slide, please. Yeah, if there's one thing that this pandemic gave everyone of us, it has to be added anxiety, like what Dr. Meredith said. Now, people dealing with cancer, both patients and their families already deal with a lot of stress than usual, and COVID even added another layer to it. So we need help, and we need to support each other through all this, through this pandemic. Next slide, please. So our society, the PSMO, did a survey among our member medical oncologists, and please allow me to share with you the results. This slide shows that a significant percentage of our patients are actually hesitant to visit the hospital during these times. Most of us, almost half of the doctors, said 50% of our patients are hesitant, and 27% of us said more than 75% of their patients are actually hesitant. So that's majority of patients and majority of the doctors. Next slide. The next slide would show that the number of patients we see decreased very significantly. And yet we know that we don't really expect, or we have reason to believe that the cancer incidence and people needing cancer treatment actually reduced this significantly. So the question is, where are those patients? Next slide would show us the delay in the administration of systemic therapy. Systemic therapies would include chemotherapy, immunotherapy, biologic therapy, targeted therapy, or even hormonal therapy. They're all systemic. Sila po yung mga gamutan na maaring makagamot or makakontrol ng cancer sa buong katawan, like systemic. So, buong katawan yung pinupuntahan ng gamot. Yun po ibig sabihin ng systemic. And 93% po ang nagsabing may delay o pagkaantala talaga sa gamutan. So, karamihan ng delay ay mula 1 linggo hanggang 1 buwan. At meron pang nagsabi na more than 2 months ang delay during this pandemic. The next slide would show us, so do we have patients who, we asked the doctors if we have patients who deteriorated or even died because of not being able to seek urgent care during these times. And almost 75% po ang nagsabi na meron. Yan po yung sinasabi namin na collateral damage ng COVID-19 pandemic. If you can, the next slide would show us some news that recently came out, no? Expecting cancer deaths because of pandemic, and another one from UK. The first one from the US, another one from UK, saying more than 2 million are actually waiting for cancer care in the UK. So we get this kind of news because this is not unique to our country, but to all areas that are greatly affected by COVID-19. And this is what we want to avoid, or at least reduce. That's why we're doing what we're doing right now, and we're having these talks with patient groups, government, pharmaceutical industries, and other concerned agencies. Next slide. So how do we deal with the patient's fears and anxiety of going to the hospital? And do we actually prioritize their safety? So the next slide would show a part of the survey that almost all of the hospitals continue to cater to non-COVID patients, which of course includes cancer patients. So nandun pa rin po naman yung mga serbisyo ng mga hospital natin para sa cancer patients at para sa ibang patients din na hindi naman COVID lang. And the next slide would show that almost 90% of our members assessed na yung centers nila have satisfactory COVID-19 protocols. So karamihan naman po sa mga doktor natin ay naniniwalang sapat naman ang mga ginagawa ng hospital administration para sa pag-iwas at paggamot sa COVID sa mga hospitals nila. And the next slide would show, so how about our clinics? Yung mga clinic naman natin, yung mga doktor. So 100% of our doctors said that we have made changes in the physical and workflow setup of our clinics. That is to maximize the safety of our patients and our staff. So this includes wearing masks, yung temperature checks. Yung temperature checks can be done actually dun sa building mismo, may not be done sa clinics. Most buildings, yun sa guard pa lang nagagawa na yun, no? And then hand hygiene, we provide alcohol sa clinics. Social distancing, nililabel namin yung seats, kung saan pwedeng umupo. Physical barriers, we put either plastic or acrylic barriers dun sa secretary at sa doctor's tables. And we most of us would request for one watcher policy, or may not even allow a watcher inside the clinics. Pwede sa labas lang sila, depende kung kaya naman ng pasyente. And almost everyone employs by appointment only, no walk-ins. So yung initial na appointment ginagawa through telemedicine or through the phone, through the secretary, and by doing that, na-filter na o natitriage na kung sino yung may mga sakit or sino yung kailangan mag-consulta muna sa ER, or yung iba naman pwedeng hindi na muna pumunta sa clinic face-to-face or by teleconsult lang, or yung initial na mga ginagawa sa clinic lang yung pag-review ng mga test results. So ginagawa na through telemedicine or teleconsult, then you actually reduce the time na exposure ng patient outside at yung exposure ng patient sa doctor, and then yung exposure ng doctor sa patient. Okay? Next slide would show that despite the hesitancy, fear, and anxiety, and of course without the other logistical reasons of not being able to do it, we still have patients who continued with the hospital visits, and mostly to have chemotherapy or to have some tests done. And the big majority, like 83% of the doctors reported that they didn't have any of those patients tested positive for COVID. So yung mga pasyente na nagpapatuloy na pumupunta sa hospital, bihira lang naman yung nag-turn out na nag-positive sa COVID. Karamihan hindi naman nag-positive. So for the PSMO, the next slide, cancer care doesn't stop just because the world stopped during this pandemic. The next slide would show us yung mga na-feature namin sa Facebook page, Cancer Experts Philippines, showing our members who continue their work as we go through this pandemic. We aim to show the public that the services continue and that we are doing measures to ensure their safety. Pag nakikita nyo po, naka-full PPE, yung mga doctors and nurses natin, ang minimum actually na PPE may not be like this na full talaga. Ang minimum according to infectious disease specialists would be a face mask, face shield, and then pag nasa loob ng onco unit, of course, yung gloves. Yun naman actually yung mask, we've been doing it even before COVID. So konting dagdag na lang. No? But a lot of our doctors and centers actually require more than just the minimum. The next slide, please. And we also showed centers and doctors from all over the country, from Luzon, Visayas, and Mindanao, just to show the public that patuloy talaga ang gamutan at serbisyo na ginagawa ng mga medical oncologists. The next slide, please. Cancer doesn't rest, and neither do we. You know, if I may use the words from American Society of Clinical Oncology, yan po yung sinasabi nila. So hindi po natutulog ang cancer at iba pang sakit natin, kaya tuloy lang po ang gamutan. Next slide. Our public hotline is actually our society's Facebook page. It's called the Cancer Experts Philippines. We meron din po kaming website, yung psmo.org.ph. Pero karamihan po talaga ng contact namin sa public happens through the Facebook page. So we presently have 60,000 followers and we receive and answer regular daily messages. We've placed a significant chunk of our annual budget for our multimedia committee, realizing the importance of disseminating information and reaching the public through social media and other platforms like TV and radio, but mostly through social media. Alam namin na doon namin mahahanap ang mga tao sa social media, especially during these times na nasa bahay. So ito yung website namin, psmo.org.ph. Yung pinakagamit nito actually sa patients na karamihan na nagtatanong through the Facebook page will be asking for doctors in a certain locality, either dahil hindi nila ma-reach yung doctor nila or for some other reason, and we direct them to the website na merong Find a Doctor directory. And a lot other things na nasa website. Yeah, the next slide, please. It would show us another online asset of PSMO, our Facebook page. We have average monthly reach of 1.2 million users, and we are proud to say that sa mga doctors na specialists with Facebook page, we have the most number of likes. These are sample questions or posts that we put in our Facebook page dealing with the quarantine. And we released this the next slide, please. We released an informative material during the early part of this quarantine. Ito po yung mga paalala sa mga may sakit na cancer upang maiwasan ng COVID-19. if you can see na tinagalog po siya, na-realize po namin pag yung post namin is in Tagalog, mas marami talagang nagla-like at maraming nag-engage at maraming si-share. No? So we posted this early part of the quarantine and we repost it ever so often. The next slide, please. We actually formulated our guidelines on cancer care in the time of COVID-19 pandemic, mainly to serve as guide for our members, the medical oncologists, on cancer management during these times. The next slide, please. We have published it also to share it with the rest of the world. And this is authored by Dr. Fred Ting and Dr. Dane Sakdalan, based in the NCR, Dr. Hania Barquez, based in Davao, and Dr. Arnold Buson from Cebu. So the next slide would show us our focus on the guidelines. So we focus on these aspects. One is prioritizing cancer care. So we guided the doctors on which cases are supposed to be dealt with urgently, and which cases can be delayed, or in which cases can be revised, modified, the giving of chemo, like instead of cytotoxic or intravenous chemo, we can perhaps employ hormonal, or instead of IV, we can perhaps consider tablet form, things like that. No? Nasa guidelines na ginawa po namin. Kung alin po yung pwedeng i-consulta sa pamamagitan ng tinatawag na telemedicine or teleconsult upang maiwasan or di na kailangan lumabas yung pasyente ng bahay, pati yung doktor, hindi na kailangan lumabas ng bahay para lang gawin yung consult. So nandun din sa guidelines para po sa magabayan yung mga doktor natin na patuloy na magbigay ng serbisyo sa cancer patients. At marami naman pong actually na hindi naman kailangan talaga ng face-to-face, actual face-to-face consult na kaya naman gawin during a telemedicine or teleconsult. Yung mga platform, iba-iba po, na depende na rin usually kung ano yung kaya naman na gamitin ng pasyente. So kung kaya lang talaga i-text or phone call, so adapt naman po yung mga doktor natin. Yung ibang mga platform would be sa Facebook Messenger or sa Viber at iba pa. So meron din po kaming guidelines on the safety of work environments and yung tinatawag na organization of transition of care, like referring the patients to centers near their locality or transferring from hospitals identified as COVID centers to those which aren't COVID centers. So we also did measures to maintain cohesion within the society during the time of isolation. So this means we continue to update everyone, all the doctors with cancer management, the modifications that we can do during this time, how to do telemedicine, and a lot of other things, such as pati yung mental health, no? Pati yung wellness, dinidili namin. Kasi nga may marami nang nagsasabi, and dahil sa dami ng mga webinars na binibigay namin or na-attend namin, nagkakaroon ng iba ng webinar fatigue. Anyways, sign lang yun, we really want to continue with the learning on how to manage cancer cases. Next slide would show us that centers, the big centers, are actually concentrated in the big cities naman. And that people have and people also have a tendency to go to these centers na nasa big cities. So we encourage people to refer, we encourage the doctors to refer to our members outside the big cities, lalo na pag malapit naman doon yung patient. Medyo problema sa Visayas, dahil Visayas actually composed of a lot of different islands. No, unlike Mindanao and Luzon, na medyo isang malaking island lang siya. So, next slide. We actually continue to learn and connect with each other. So, next week, we're actually having our mid-year convention, which is virtual. It's our first virtual mid-year convention. It's called Heal, Pray, Live, Celebrating the Filipino Survivor. And po, mangyayari siya July 1 to 6 So lahat ng medical oncologists are encouraged to join the 6 days actually. Usually nighttime namin gagawin yung mga webinars. And through a video that we created, next slide, we shared our guidelines to the medical community through a platform for doctors called Doquity. No? Kasi nga, yung guidelines naman talaga, initial na purpose namin is really for doctors. Initially, we shared it with our members, but we, realizing that not just medical oncologists actually take care of cancer patients. Some patients go through a multidisciplinary team naman. So we shared it also with other doctors through this platform, Doquity, and to the public through our Facebook page, the Cancer Experts Philippines. So in summary, cancer patients are more susceptible to severe COVID-19 complications, and exposure of these vulnerable patients to the clinics and to the hospital should be minimized as much as possible. The risk-benefit ratio for cancer patients during this pandemic should be discussed and by the doctors to their patients, and prioritizing of patients should be done by the doctors. Final decisions would depend on the patients and their attending oncologists. So in these challenging times, the safety of our patients, their family, and of the healthcare workers will be our utmost priority. So that would be my last slide. Now we can proceed to the next part. Thank you, everyone. Salamat po.
Thank you for that very informative talk, Dr. Bill. So at least now the public is aware na meron tayong mga ginagawa, tulad ng sinabi ninyo, to keep them safe while they are being treated. So for the urgent cases, kami pong mga medical oncologists at mga doktor ay available pa rin para kayo ay tignan. And para naman po doon sa mga stable, ang sakit or nagmo-monitor na lang, meron din po tayong telemedicine platform. So please be reassured that we are doing everything we can para po mapanatili at mapagtuloy ang pangangalaga sa inyo habang mine-maintain ang safety ninyo kapag kayo ay pumupunta sa hospital. So thank you so much for that, Dr. Bill. Okay? And then for the next part of our program, we are fortunate to have two fervent cancer advocates with us today to serve as our reactors. So we have Mr. Paul Perez. He is the current president of the Cancer Coalition PH and founder of the Project Brave Kids. We also have Ms. Magsanoc-Alicpala, Vice President for Internal Affairs of the Cancer Coalition PH and founding president of ICanServe. Please welcome Mr. Paul and Ms. Cara to be our reactors for the talk today.
Thank you so much, Doc Meredith. Thank you so much from Hoping from Within, and as well PSMO. It's an honor to be working with you on this particular project. Well, as you all know, the Corona-19 virus is the first pandemic in our lifetime. So because it's a new experience for everyone, it has brought about major disruption in the lives of so many. And the vulnerable amongst us suffer the most, notably our cancer patients. The battle against cancer is formidable even in the most normal circumstances. And this pandemic is adding more to their burden. The numbers in the presentation of Dr. Bill says it all. Among the respondents, over 93% had delayed administration of systemic therapies. And among the doctors who responded, they basically said almost 74% said their cancer patient deteriorated or even died. Indeed, cancer patients seems to be the collateral damage again in this fight. We are now over 100 days into the lockdown, yet we're still struggling to figure out our way through all this new normal. And we could have avoided this. To our minds, if only we had the National Integrated Cancer Council set up in time, like in November as the law mandated, then things might have been different. In the law under Section 5, the Council shall act as a policy-making, planning, and coordinating body on cancer control under the Department of Health. Now more than ever, we need policies, we need planning, we need a coordinating body that will guide us that will guide everyone, most especially in navigating through the pandemic. We hope the Department of Health heeds our call to urgently form the Council, as it's not yet too late, recognizing that COVID is still very much still in our needs, and the possibility of a second wave can still envelope us, and or worse, there might be another pandemic. The National Integrated Cancer Control Act, or RA 11215, detailed the role of the Council so well that I believe a lot of the concerns that we're facing now could have been addressed. One of the things I find striking in the numbers that was shared earlier is the safety of patients. I really congratulate all the hospitals and all the cancer centers and facilities for instituting big safety measures. So there is a need for us to reassure our patients that the moment they step out of their house or go to their treatment, they need to feel they are safe. In the Lancet Oncology article, it's been recommended to avoid COVID, behavioral modifications will have to be adapted, including staying at home, not gathering in public places, and not touching other people. All these we know very well because there's so much mass communication on this aspect. But part of the recommendation as well is to limit or not to travel at all, or no non-essential home visitors, and public transport should be avoided. We have to accept the reality that several cancer patients in our country use mass transport and will have no other alternative but to use this despite the recommendation to avoid it. As such, we renew our call on the Interagency Task Force on COVID to come up with policies or guidelines or issuances to ensure cancer patients are protected by having a special area similar to what has been extended to PWDs in buses or in other mass transport vehicles. We hope when we finally open up or make mass transport available again, this will be made available as well, for the safety of our patients is non-negotiable. We have heard a lot about the whole idea of whole of society and whole of government approach in solving COVID. Having a very definite guideline for safe access to mass transport for our cancer patients is a clear manifestation of this approach, and this brings about partnership building between the government and all stakeholders of society in addressing this health risk. The issue of safe access also brings forward the need to implement another provision in the National Integrated Cancer Control Act, Article 3 to be very specific, which talks about quality health systems. This law provides a platform for the establishment or strengthening of regional cancer centers to provide timely, developmentally appropriate, and high-quality cancer services. Many patients in the provinces come to Metro Manila for treatment. When the lockdown was implemented, all of a sudden, they could not access treatments because they cannot cross the borders. We've heard similar situation in the Visayas where patients from the other islands can get into Cebu, as Cebu was or is currently on a lockdown. Thus, it is of utmost importance to accelerate the creation or the upgrade of the cancer centers and facilities, most especially in the regions. The law allows us to get into private-public partnerships, as such setting up and scaling up cancer centers and facilities can be initiated soon. It also allows the establishment of networks with both public and private facilities to improve access, expand range of services, reduce costs, and bring services closer to patients. The other area I wanted to bring forward, though, but not mentioned as much, is the fear that most cancer patients that a lot of our programs for the balance year or the coming year will not have funds or will not be funded. As such, we call on our legislative champions in Congress to ensure that there is an adequate budget for cancer. As we all know, Congress is about to discuss the 2021 budget, and we are asking legislators to ensure a separate line item for cancer as mandated in the NICA law. Allocating adequate budget for cancer is the least we can do for cancer patients. In doing so, we hope access to funds will be unhampered to ensure continued treatment of so many of our cancer patients. For some days now, we've seen the use of PWD or the abuse of the use of PWD cards in the news. This is being abused by some, but at the end of the day, at the other end of the line, cancer patients, people living with cancer, and cancer survivors are still waiting and waiting and waiting to gain access to this. It has been clearly stated in the INICA law that under Article 7, Section 25, that cancer patients, people living with cancer, and cancer survivors are considered PWDs. We don't understand why, until now, despite the RRR signed last August, we are still not implementing this. The IRR states that DOH, PhilHealth, FDA, SHED, DepEd, DOLE, CSC, TESDA, DILG, NCDA, DSWD, and other concerned government agencies shall issue a corresponding guidelines, circulars, or directives related to the rules within 6 months after its effectivity and disseminate such information to all concerned. That 6 months lapsed last February, way before the lockdown. Any further delay is a great injustice to the cancer community. I just want to end this reaction by sharing what Ned Sharpless, the director of the National Cancer Institute in the U.S. said. Ignoring cancer or ignoring cancer care now may trade one public health crisis for another. So let's avoid that scenario. Let's give cancer patients the attention and support it richly deserves. Thank you. I think, Kara, it's your turn.
Okay. Thank you. Thank you, Paul. I just want to greet good afternoon to everyone listening, especially my sisters from ICanServe Cebu, mga kababayan ni Dr. Bill Ramos yan. Hello to Living Hope in Tagum, Mindas Buddies in Baguio, mga kaibigan natin sa PGH and other support groups in Cavite as well. ICanServe Manila also, ang mga tumutulong sa Cancer Coalition, Cancer Warriors, Papo, at iba't ibang grupo. Sorry, hindi ko kasi nakita lahat ng pangalan niya sa Facebook Live, but thank you for joining us. And also the doctors or the frontliners of PSMO, thank you to you and your families for all that you do. We really appreciate it. Many thanks. And Dr. Bill, thank you for your presentation. It was very disturbing. Parang matagal na natin alam na ganyan naman talaga ang kalalabasan ng presentation mo, but to see the numbers, it just became so real. And that's just a snapshot. I can't imagine what the entire landscape is like for the country. And one narrative I wish to add to Dr. Bill's presentation is, let's not forget, the poor patients are actually getting poorer. Cancer care expenses is something they can't afford anymore. A lot of them are losing or have lost their jobs, or someone in their family has. They're going hungry, they're nutritionally deficient. There's so many things, they need our help. So the COVID-19 pandemic is really certifying urgent. A lot of things we knew we had to do before, but things that are not being done, especially by government. Paul mentioned that sana nga that a lot of the provisions in the cancer law had been implemented sooner. It would have eased all our difficulties this year, especially the cancer fund. That's one of the special features of the law, and we're nowhere near funding the cancer fund. Until that happens, I wish that whatever is in place, the go-to places, the go-to funding agencies for cancer patients will remain funded or should be funded. Kasi alam ko kapos na places like PCSO, DSWD, DOH, or even the malasakit centers. Not only being well-funded, but they also should, I think access should be easier now. Sometimes they're online, sometimes they're not. The other day, Paul showed me pictures of lines outside DSWD. They're quite disturbing. I think even before the pandemic, we kept suggesting that there are technology-based solutions to things like this to make it easier for patients. I mean, places like the U.S. Embassy or even the banks have solved this using tech-based solutions. Like at the U.S. Embassy, I remember long ago, the night before, ang dami ng nakapila. Now it's by appointment, and you can mail the requirements ahead of time, and you can also receive whatever you need to receive in the mail. And in some banks, and like the one I go to, when I go, I punch in the service I need in my cell phone. I get a slip of paper that tells me at different intervals when my turn is near. I mean, things like that. Why can't we do that, and it's more urgent now because you don't want patients out of their homes. The pandemic also certified as urgent our digital transformation. We keep hearing the word telemedicine, but what is it really for the poor? We need to reimagine what it can look like for them. I mean, they don't have smartphones, connectivity is spotty if they have it at all. Some of them don't have electricity even, so how can they even think of doing telemedicine? We even have to teach them how to warm up to the idea of talking to someone they don't know. You know, talking to a flat screen, especially for the poor because they don't have dedicated doctors the way a lot of us do. They just walk into a public health facility, whoever is available, yun ang doktor nila. So every time they come back, paiba-iba, uulitin na naman nila yung kwento nila. So mahirap. And if you never had a relationship with this doctor, it's hard to have an online relationship. Unlike tayo na may mga doktor, you know, you've known them so well, you trust them, so you can talk to them kahit walang mukha, kahit telephone lang, you know. And that's the one thing we need to restore. We need to restore patients' confidence going back to the hospital, seeing their doctors, continuing treatment. So we need to help them stay in touch. In Taguig City, their version of telemedicine is simple. They posted hotlines of each barangay center in all their social media pages. And then all the patient has to do is call or text the health center, tell them what they feel, whatever symptoms they have, and then someone texts them back an appointment with a doctor. So the doctor calls them back, and then the doctor will assess if the patient needs to go to the health center. Taguig City also has a Facebook Messenger group for their patient navigators and breast cancer patients. So these are all simple innovations that has worked for them, and many should figure out their own version of telemedicine for the poor. And this is a good time also for patient groups to learn to be digital savvy. I know it's not easy. I'm also a dinosaur in a way, but we must teach other patients, and we must maximize all the online learning opportunities going on right now. You're lucky if you live with a millennial or some digital savvy person. Otherwise, it's hard to survive. So I bug my daughter a lot for stuff like that. But after Paul gave us all the bad news and the things to complain about, I'll focus on the positive. I think one, it's a small thing, but for me, it's a big deal that I think the pandemic has taught a lot of Filipinos better health habits. We're all washing our hands now. I mean, a lot of mothers or women complain about getting their children to wash their hands or even their husbands to wash their hands after using the bathroom. So, but seriously, hand washing is helpful for many other things like avoiding eye infections, skin infections, respiratory infections. And one of the best things we saw in March especially was how almost everybody was fundraising, whether in cash or in kind, for PPEs for the cancer frontliners. It broke our heart seeing so many frontliners dying just because they didn't have ample PPEs. People were making them in their homes. People in Baguio, Minda's buddies, they were making ear savers for the masks. The fashion industry were making coveralls. Everybody did their bit. And we at ICanServe, Cebu and Manila, we also did the same thing and at the coalition. But this time, our fundraising was geared towards cancer patients and cancer frontliners, since all the budget was going to COVID frontliners. So we decided to help them. And, you know, you think, I'm sure all of you listening own a mask or boxes of masks or several fancy masks, but we take it for granted. A filmmaker friend of mine went filming in Tondo, and her filming team came in full PPE gear. And when they got there in this place in Tondo, it felt like there was no pandemic. Nobody was wearing anything protective. And when she asked around, they just said simply they couldn't afford it. They don't even have makeshift handkerchiefs to use. So don't take it for granted. Help people, even the ones near you, your household help and their families, your secretaries and their families. Always think of the families. Kasi marami yan, and you know, really not everyone has it. Another good thing, we also saw the goodness of volunteers in terms of addressing the big barrier of transportation, especially during a lockdown. The Cancer Coalition and ICanServe formed a program called Magsanoc-Alicpala. we put up a free Hatid Sundo program for patients on treatment. But we could only service Metro Manila and the neighboring provinces like Laguna, Cavite, Rizal. It was hard to go past the checkpoints because there was a lockdown in almost every city within Metro Manila. But we are grateful we were able to get help from some LGUs. We made referrals to them. And it's actually something they can do and should do, but because they were so strained for resources, they can't service all their patients. Thankfully, cities like Pasig and Taguig actually had dedicated transportation for patients. It's a program they really carved out, and we're grateful for that. And when we were making a call out for volunteer drivers, we attracted all income brackets, even former Grab drivers who were temporarily out of a job. We even attracted cancer survivors and some seniors who we had to turn down because of safety. And it's also been a transformational experience for the drivers. One driver who had gotten to know this patient asked us once, what are the favorite songs of this particular patient? Because I want to prepare a playlist when she rides my car again to make her happy. And, we have so many patients so grateful because it's the first time they ever have a driver, someone waiting on them. That's royal treatment for them. Something they've never experienced in their life, and they're very grateful. They always attempt to tip the drivers, and of course the drivers decline, and they always get food gifts. So it's very nice. Some drivers come to us crying, very happy. We're a small operation, but we've managed to help about over 160 patients, mostly children. We've had requests from Mindanao, from the Visayas, but sadly we couldn't service them because we didn't have the resources. But we see the need is still urgent and real, so we want to try and expand this program. Please help us find partners, whether transport partners, individuals, organizations, groups like Grab, who can help us make this fly. It's even more humbling because when we talk to Dr. Bill in Cebu, the problem is also inter-island vessel, especially now with their lockdown. So patients that normally go to Cebu, like from Masbate, from Bohol, Tacloban, have no way of going to Cebu for treatment. This also actually gave rise to the problem of transporting medicine. So the coalition with the Cancer Warriors taking the lead also found ways to transport medicines to different areas, medicines that were not necessarily cancer. So we did that. And once transportation is full blast and fully operational, it will still not serve the whole riding public, which is a scary thought because they're only allowed to fill it up by 50%. So what happens to the other 50% that can't get a ride? In Metro Manila, that will translate into 7 million trips not being serviced. That's 7 million trips according to the Move As One coalition. So I don't know what's going to happen to these the riding public, especially, where do patients stand? That's why all the more we're driven at the coalition and ICanServe to really figure out how to continue providing transportation and hopefully extending this service all over the country. We have engaged the IATF, like Paul said, and they promised to get back to us. But what struck us is when we asked them what their plans were for patients, especially cancer and dialysis patients, those are the two disease groups that go to the hospital a lot. What struck me was they were dumbfounded, they were lost. It just showed that we were nowhere in the radar. So to all you cancer advocates, tuloy-tuloy lang po ang pagkalampag natin sa mga mambabata, sa mga tao sa gobyerno, kasi we have to be part of the conversation all the time. We have to assert ourselves. Pero, yon. Another good thing, panay na ako complain. So, another nice thing I noticed with COVID, we became more neighborly. Ako, at least in my village, I got to know more neighbors, naghihiraman ng eggs, mantika, gamot. It really bonded the village. Kung saan nakatira naman si Paul, if I remember the story right, somebody got sick, not of COVID, so they just sourced a doctor within the village, and he cured the patient and gave his services for free, just to make sure that the patient wouldn't go to the hospital. So there's a lot of neighborly love that went on during the COVID. I also noticed a lot of instant support groups, lockdown cinema groups, groups that do gardening together, baking clubs, ano-ano po yun. And these are very effective platforms to bust loneliness and depression. And that's one thing we can do for the cancer space. And I think a lot of you have been doing. But whatever it is you're doing in your cancer space, strengthen your circle. Continue to do this, whether you're a health worker or a patient group, or just within friends who are civic-minded. And as you strengthen your circle, keep in mind that you eventually want to coalesce with other circles and eventually become a sectoral circle so you can make ripples. And that was one of the strategies we used for the Cancer Coalition in passing the law. We just kept engaging different groups and widening our circle. And that's one of the key things we need today to survive, to strengthen partnerships. We at the Coalition are working with a lot of medical societies now in a deeper way. Before, we were confined to just doing forums, free clinics, or consulting them on issues, but now we're embarking on joint long-term projects like a patient navigation app, for instance. And if you were to scale this up, it would be good to also have stronger LGUs. More than ever, the COVID showed us that the LGUs have to be self-reliant. And a lot of them stepped up, thankfully. And in cancer terms, I wish it would mean that every LGU can service the entire continuum of care, have facilities for diagnostics, for treatment, palliative care, the whole shebang. And they should have well-stocked pharmacies with affordable medicines. They should have funding for the poor. They should have patient navigators and a complete team of doctors. I know it's not something that happens, but we have to demand for it, and we have to help make it happen. We have to be part of the solution. It also means that it helps if you elect a good mayor, so that you have a really strong LGU. Before, when we were campaigning for the cancer law, one of the things we members kept talking about was, parang mantra to, in 10 years, the World Health Organization said that the cancer incidence can increase by 80% in 10 years. And the World Health said this would be a big strain financially, and especially in the Philippine health system. It was a scary thought, but something I couldn't really imagine, honestly. But now that there is a pandemic now, and it's worse than what was projected for cancer, it's really scary, and I don't want to wait for 10 years for that cancer pandemic or another pandemic. I mean, we had all the chances to prepare for cancer. The whole world had an opportunity to prepare for the COVID pandemic, but we missed all those chances, and the price we paid is too high. It really shouldn't happen again. And even though we keep demanding government to do a better job, I mean, that's an understatement. We also have to do our part. Patient or health worker, we really need to work together to survive this. So that's it. Thank you.
Thank you, Sir Paul and Ma'am Cara, for those very productive insights. Tama po kayo, no? I think we can't stress that enough, the importance of the actual implementation of the National Integrated Cancer Control Act. So honestly, even in the clinics, that's something that we get asked a lot. So our patients are aware about it. So they would ask us, how come they are not feeling it yet? So yeah, we all hope that soon the provisions of the Act will be implemented in order for the benefits to be cascaded down to our patients. And thank you also, Ma'am Cara, for listing down the positive things that came out of the COVID situation. Because you're right, it's not just all negative. There's actually a lot of good things that we've been seeing on social media about how people are actually giving help to other people, assisting with free transportation and other voluntary activities. So thank you very much for plugging that into the discussion. Okay? So we now come to the next part of our program, the interactive part. So we will now be entertaining questions from our viewers. So actually, I have already been receiving some of the questions already sent to our Facebook pages. So let me start with the first one. So we got this question, maybe for Sir Bill. Paano po nag-work ang telemedicine? Pareho po ba ang bayad nito sa regular consultation?
Okay, paano nag-work? So iba-iba siya, no? May mga platform talaga na existing na telemedicine, no? Pero yung experience ko talagang mahirap siya i-implement sa most of the patients, no? Especially yung patients natin. Cancer is actually still a disease of the elderly. So, generally a disease of the elderly. So, marami talagang hirap dun sa existing platforms talaga na telemedicine. So, ang nangyayari, realistically, ang nangyayari talaga na telemedicine muna means, or teleconsult, yung paggamot, ginagawa ng malayo. Yun yung tele, no? Hindi siya actual na face-to-face na magkaharap talaga yung pasyente at saka yung doktor, no? So, ang nangyayari ngayon na nagagamit namin, yun pa rin dati na karamihan sa telepono, no? Either sa phone or minsan sa text, na actually dati na namin ginagawa. Yung ngayon lang, somehow, may singil. Kasi yun yung ano talaga sa telemedicine. Of course, pwede ka naman hindi rin maningil. Pero yun lang yun sa telemedicine, sa teleconsult. Yung iba na ginagamit aside from yung pag-uusap sa telepono or sa text, kung may kailangan kasing ipadala na result na hindi mo kayang basahin, kasi marami. So, pwede namang ipadala sa email. Yung iba naman kung walang email, kasi talagang may iba hindi alam yung email. Yung messenger, kasi karamihan naman ng Pilipino may Facebook. No? Sa messenger, pwede na rin ipadala. Kung yung iba may Viber. Kung wala mang Viber yung pasyente or messenger, usually may anak naman sila or may kasama sa bahay na meron. So, yun lang ang nangyayari. Yun yung ginagawa. So, pagkatapos noon, yung interaction ng doctor sa kanong pasyente, nagbibigay na rin kami ng mga advice or pag may prescription, pwede rin ipadala kasi yung tinatawag na e-prescription, pwede siyang ipadala again sa email, sa messenger, or sa Viber. Na pwede naman nilang ipakita actually sa pharmacy at may memo naman yung FDA na kaya siya, na dapat tanggapin yung tinatawag na e-prescription na pwede siyang gamitin ng pasyente para sa pagbili ng gamot. So basically, ganun yung telemedicine. Yung pag-charge, iba-iba. Ang karamihan na kaya or alam at familiar yung pasyente, yung mga Palawan, yung mga Luwilier, mga ganon, or GCash. No? Kung minsan, diretso sa bank-to-bank na transfer, ganon. Pero ang common talaga na alam ng pasyente would be yung Palawan, Luwilier, at saka GCash. So, mga ganon. Iba-iba rin yung style ng doctors. Yung sa telemedicine actually na platform, dapat nagbayad na tayo bago pa gawin yung consult. Iba namang doktor na pumapayag naman na after yung consult, especially kung old patient. Kilala mo na, at saka follow-up, mga ganon. Pag new consult, karamihan talaga yung general na rule, pinagbabayad muna bago yung consult. So basically, ganun yung telemedicine. I hope nasagot ko yung tanong.
Thank you, Sir Bill. So, tama po, no? Depende kung nasaan. Kasi like sa amin, ako sa province din po ako, medyo hirap yung patient kapag medyo mas high-tech. So, pwede na minsan po text lang or email or yung mga messenger po. Yun yung ginagawa namin mostly. Pero yung mga sa Metro Manila, usually we have the applications po wherein you can book your doctor, kung anong oras, etc. Okay? So, if meron po kayong mga katanungan, pwede po kayong mag-type ng question ninyo. Depende kung saang Facebook page kayo nanonood sa amin. Okay? So, for our next question, for Sir Paul, wait lang. Ayan, nasabi ni Sir Paul ang Cancer Assistance Fund. Paano po kami makakakuha ng tulong mula doon?
So, ngayon, kasi hindi pa klaro. Kayo nang hinihingi natin na klaruhin ito, apondohan ito. Ang nasa batas kasi dapat merong cancer assistance fund na kung saan maglalaan ang gobyerno ng sapat na pera para mabigay ito for the medicines and other treatments na pangangailangan. Ang ngayon kasi sa DOH, meron silang BCMAP at CCMAP, no, ang Breast Cancer Medicine Assistance Program. Tinutuloy pa rin yun, pero minsan kasi nagkakaubusan. So ngayon, kung ang current situation ang tanong, doon sila makaka-access. Pero ang dami kasing limitasyon yun. Kaya doon sa batas, we try to address that, no, by having a more systematic way of managing that fund. Pero unfortunately nga, hindi pa na itatayo. Kaya yun ang hiling namin at hinihilingi namin ang lahat ng mga kasama natin sa laban na kalampagin nga ang ating kongreso na sana sa 2021 kasama siya sa budget. Kasi yun naman ang nakalagay sa batas. We're not asking for anything new. No? The President has signed that into a law. It is very clearly stated in the law that ang pondo para sa cancer ay nakahiwalay dapat sa ibang mga klaseng sakit. So dapat mangyari. Yun ang aming hinihiling.
Thank you, Sir Paul. For our next question, for Sir Bill, lahat po ba ng test na kailangan ng mga cancer patient available ngayon at libre ba kapag sa government hospital?
Karamihan ng test na ginagawa, no? Okay, ito. Yung mga importanteng serbisyo na kailangan magpatuloy ngayong pandemic, minimal lang naman yung mga kailangan na test. No? Kung mag-chemotherapy para ipagpatuloy yung chemotherapy, mga blood tests lang naman na widely available naman din sa mga hospital, or kung ayaw ng pasyente na pumasok sa hospital, yung mga outside laboratories, meron man po. Pag government hospitals, karamihan naman na available din. Kung minsan lang, yung mga tests na kailangang i-check kung kumusta na yung cancer, kung may kalat ba o wala, yun yung mga medyo special na tests. Most of them naman, no, meron. Like yung ultrasound or yung x-ray or kung minsan CT scan, meron. Yung CT scan, yung isang tanong ng mga pasyente kasi karamihan ng mga COVID patients nagsi-CT scan. No? Ina-assure naman tayo ng mga hospitals na kahit most of the hospitals actually, walang dedicated na CT scan na para lang talaga sa COVID. Unfortunately, hindi po kasi ganun siya kamura. No? Pero ina-assure naman tayo na after every patient, nagdi-disinfect po sila ng buong room at ng buong mga facilities for those procedures bago naman gawin yung susunod na patient. No? At para lang sa safety rin ng pasyente at ng lahat na nandun. So basically, yung mga tests available naman po. Nasagot ko ba yung tanong?
Yes, Sir Bill. For the next question can be answered by all panelists. Sana lahat ng LGU kasama ng Cancer Coalition sa magsikilos. Aside from Pasig and Taguig, may ibang LGU pa po ba na may programa para sa cancer?
Parang yun lang yung alam namin. But the thing is nga, every one of them can do it. They really do it, kaya lang kinukulang lang sila. Yun eh. Like when we were doing it and still doing it, we got the cooperation of Cavite, a lot of places in Rizal. So, tatawag-tawagan lang namin kasi minsan wala rin sila. So, tulungan lang talaga. But that's a good idea to really formalize it. I think the IATF should actually spell that out when they really address the concerns of patients regarding transportation. I just want to add something to the previous question, or a point that Dr. Bill made. That's one of the asks of the coalition, the creation of COVID-safe spaces in hospitals, because a lot of the cancer centers are almost on the same floor as the emergency room in any hospital, and not all hospitals have separate entrances or separate facilities. Maybe it's not entirely possible now, but maybe moving down the road, it's something to be considered.
I just want to react as well, in addition to what Carla mentioned about LGUs. Tama yung premise na dapat kasama sa solusyon ng LGUs specific to cancer. No? We've seen examples already like Taguig and other areas na kaya. So, ang LGUs, pwede silang maglaan ng sarili nilang pondo, pwede silang gumawa ng sarili nilang programa, and if this is transport na ang issue, pwede nilang gawin yun. So, kung saan man kayong banda sa Pilipinas, we don't have to wait for a national effort. No? Pwedeng simulan yun, pwedeng tanungin, pwedeng isulong yun sa ating mga local executives.
Thank you.
Yun lang po.
For our next question, everyone can answer if you have contributions to it. Can we trust po the cancer educational resources we see online? Where can we access reliable information?
Dr. Bill na yan.
Okay. Yun yung pinaka sa amin po, no, na ina-adjust naman talaga namin yung information para maging relevant siya sa Pilipinas. Yun po yung sa Facebook page namin na Cancer Experts Philippines. Dun po, regular po yung paglabas namin ng information at kung may tanong man po kayo, sinasagot naman po namin agad-agad. Marami tanong, so rest assured na sasagutin naman po namin yung mga tanong nyo kung ano man yung mga kailangan yung malaman. Yung website po namin, psmo.org.ph, meron din po kayong makikita mga information doon. Separate po yung, magkaiba po yung section namin para sa mga doktor, magkaiba rin yung para sa pasyente. Kasi alam naman namin na yung language na gagamitin, iba pag doktor, saka iba rin pag pasyente. So, yun po yung dalawa na pwede yung kunan ng information na relevant sa Pilipinas at saka sa Pilipino. Marami pa pong iba naman, no? na mga international, no? na makikita nyo rin yung American Society of Clinical Oncology, National Cancer Institute, mga ganun. So ingat lang din po sa mga information na tinitingnan natin kasi hindi naman lahat. Kasi sa internet, kahit sino pwede maglabas. No? Yun lang po yung ano namin, na mag-iingat din tayo sa mga information na kinukuha natin at pinaniniwalaan natin. Kasi nga, hindi naman lahat totoo at hindi rin naman po lahat applicable sa atin or sa cancer.
Thank you, Sir Bill. So I would also like to add the Hope From Within Cancer Advocacy page. So they are actually part of the organizing body po for this webinar. So they also put out information na tailored po for us Filipinos po. So you can also follow their Hope From Within Facebook page po. Okay? And then we also have comments para po sa Cancer Coalition. Believe ako sa Cancer Coalition. Salamat sa pagkalampag kahit sa IATF para sa aming mga pasyente. So thank you po.
Thank you rin.
Opo.
Kasama namin sila dapat sa pagkalampag.
Yes, tama po.
Marami pa pahiingin.
Yes po. And then another on that note po, Cancer Coalition team, thank you for all your support, especially in this kind of situation. It's a big help to children with cancer, the transportation you provided for them. Salamat po. Then, we have another question. If my doctor's clinic is still closed, where can I find another oncologist?
Ayan, Dr. Bill.
Masasagot rin niya ni Mere. Sagutin mo.
Ayun. Ayun po.
Si Meredith po yung ano namin, nasa multimedia.
Sige po.
Multimedia ng society. Ayan.
Actually po, if you will tell us, you can send po to the Facebook page of PSMO. We have helped quite a number of patients who are looking for their actual doctors. So if ever you already have oncologists and you can't reach them, pwede niyong sabihin sa amin and then we can help you get in touch with a specific doctor. Or if you are a new patient na kailangan po ng new consultation, pwede rin po namin kayong i-direct. We actually have a directory. It's accessible po sa aming website and sa aming Facebook. So doon po namin nililista yung mga hotline of cancer centers na tumatanggap ng inquiries kahit sa ngayon. And then actually, any question that you might have, basta matutulungan namin po kayo, just shoot us a message po sa aming Facebook page. And meron pong sumasagot doon everyday. So, kung meron po kayong katanungan, anything related to your care, pwede po kayong mag-send ng message po sa Facebook. And we'll gladly assist you na makarating sa kinauukulan yung tanong nyo na kailangang masagot. Any more questions po sa message box? So I guess that's it. Okay. So thank you to everyone who listened in to the webinar, and thank you also to our panelists who gladly shared their time and insights for us to have a better understanding and picture of how it's really happening out there sa panahon nitong COVID. So some important points. Number one that we would like you to remember from this session is that cancer care does not stop. So your doctors, your patient advocates, private sectors, we are all working together to help continue giving the care that you need. But as Sir Paul and Ma'am Cara said, it's very important for us to demand the implementation of the NICA, because it has already been signed, but we are still waiting for the implementation of the provisions. So, tama po si Sir Paul, it's very important na sana maging active yung mga regional cancer centers natin so that even our patients in the provinces and other far-flung areas will be able to access prompt cancer care. Also the provision of adequate transportation services and delivery of medicines, especially for those who are in the provinces, and also the provision of benefits like PWD and other cancer assistance benefits for our patients. And yun, very important, the cancer assistance fund. It's something that our patients have all been waiting for, and we can't wait to tell them na yes, it's already active, pwede nang gamitin at makakatulong na ito para sa kanilang pangangalaga. So, yun, we are all in this together. So, sama-sama po tayo na magtulungan. Ipagpatuloy natin yung mga magagandang habit, mga magagandang pag-uugali at pagtutulungan na lumabas mula nung nagkaroon ng pandemic. Rest assured na that there are ways to keep giving the cancer care that you need. Your doctors, hospitals, and other stakeholders are doing what we can to keep you safe while you are receiving the care that you need. So in this time of pandemic, so we are facing a huge battle. Cancer is already a huge battle. With the addition of the pandemic, it's a very difficult time, especially for our cancer patients. Now more than ever, we need all the support, we need the solidarity to come together, okay? The patients, the health sector, the private sector, even the government, to advocate for the continuous provision of care for our cancer patients while prioritizing the safety and well-being of everyone. So again, maraming salamat po sa lahat ng nakinig para sa araw na ito, and maraming salamat po ulit sa ating mga magigiting na panelists na nagbigay ng nararapat na impormasyon para sa araw na ito. Salamat po. God bless.
Thank you.
Okay.
Access to cancer treatment is important because it increases cancer survivorship and reduces the burden on families and cancer patients. I am Susan Africa Manican, the wife of the late great actor Spanky Manican. As caregiver, I held Spanky's hands throughout the physical, financial, and emotional challenges of the cancer patient journey. Being a cancer patient caregiver is very challenging. But believe me when I say, may pag-asa pa at may magagawa ka pa laban sa cancer. Hope from Within is an advocacy that promotes cancer awareness, better access to new treatment options, and hope for survival for all patients. The Philippine Society of Medical Oncology currently has ongoing efforts to push for better access to more responsive and affordable healthcare services for cancer. Join us in advocating for equitable, affordable, and timely cancer care services. You can sign the petition by visiting the link below. To know more about the advocacy and want to be part of a community that aims to renew hope and optimism for the thousands of cancer patients and survivors, follow Hope From Within's Facebook page at Hope From Within PH or visit hopefromwithin.org.
I would say that the first signs were the common diagnosis, self-diagnosis of a smoker, that which we call the smoker's cough. So I was just attributing the coughing that I was having to, I think, yeah, I've been smoking for years already, so this is just part of it. And it wasn't really a bothersome cough at that, so I really didn't pay too much attention to it. I didn't know that it was already dangerous. Fear, of course, the first thing was fear. As a smoker, it was the one thing that you knew that there was that chance always, but you always were trying to talk and convince yourself that it's not going to happen to you. Had it been anything that had to do with my work, I could easily say, modestly aside, I know what I'm doing. But when it got to this disease, I had to really put my life in the hands of my doctor. We started with Dr. Romel Carino, my thoracic vascular doctor. The first action was to remove the lump on my lower right lung. He had to take away a third of my lung. About after a week, my oncologist saw me, and then he told me, I would rather that we do treatment for you. And I would say that I'm very blessed. The Lord blessed me because it was found early. But that, aside from that, the treatment went fine and well. I would dare say that I was very blessed that the Lord gave me a family. That He gave me a wife, He gave me 3 children who were very supportive and who really, they were really my source of strength and hope when I was going through this disease, through this trying time in our lives. A big part of the healing process is brought about by the caregivers who are around you or the people who will take care of you as you go through your journey of healing. It really is one step at a time when you think about it, because there's, first of all, it's the acceptance that you have this disease, and then it's the journey that you have to go through. Like, it's always there in your mind, every hour, on the hour, you're thinking about it. You're starting to worry that you might not get through this. The important thing is being honest to yourself and honest to your caregivers, especially if your caregivers are mostly your parents or your family, your wife, your children. Basically, the only advice I can give them is, for the caregivers, be strong for the people who are going through this sickness. Make them know that you'll be there for them and that you're not going to give up on them, no matter what happens. And for the guy or the girl who's going through it, like I said, you can depend on everything else, but the most important thing is depend on God. Call upon Him. Unfortunately, I lost my eldest son to this disease. And I wouldn't want to see more people being taken by this disease.
Malaya akong lumalaban sa sakit na nagpapahirap sa maraming Pilipino.
Nagpapahina sa kaibigan, kapamilya at kapuso.
Malaya akong lumalaban sa paniniwalang ang pagaling ay hindi lamang isang pangarap.
Dahil ang pag-asa ay para sa lahat, mayaman man o mahirap.
Malaya akong lumalaban sa pagwawalang bahala dahil sa isyong ito, buhay ang nakataya at kinabukasan ng pamilya.
Malaya akong lumalaban sa pagkakanya-kanya dahil mas malakas ang ating tinig kung tayo magkakaisa.
Malaya akong lumalaban sa cancer.
kasama ng mga nagtagumpay laban sa sakit na ito.
Kaisa ng mga biktimang hindi sumusuko.
Malaya akong lumalaban sa cancer.
Kasama ng mga taong umaasa na sa malapit na hinaharap. May kalayaan na sa cancer para sa lahat.
Malaya akong lumalaban sa cancer.